Life, especially in nursing, is full of pressure, pain, and unpredictability. But what sets us apart is not how often we fall, but how we rise. This strength, this ability to push forward despite the storm, is what we call adversity quotient, our measure of resilience. Good day, everyone. We are from BN3B Group 1B. Today, we will present to you a research entitled Level of Adversity Quotient Among Nursing Students by CARBONILLA III, CHUA, COBRADO, CUETO Jr., and Los Santos. The research study aims to determine the level of adversity quotient of nursing students. For our research design, our study employed a quantitative approach in collecting and describing the responses from the survey. Specifically, our study used a combination of quantitative descriptive research design and comparative design, as it is well suited in answering the research questions presented in the study. Survey method was used as a primary data collection method due to its ability to provide consistent, structured responses that enable the researchers to efficiently analyze the relationships between demographic profiles and AQ scores.
For the instrument, the study utilized an adapted standardized survey instrument from Attore, Tehrani, and Razaka 2020, consisting of questions that evaluate 4 key dimensions, which are control, ownership, reach, and endurance. For validity, RMSEA score of 0.039 and GFI scoring of 0.977 was used. For reliability, Cronbach's alpha score of 0.798 was used. The survey questionnaire will be divided into 2 sections. Part 1 consists of the socio-demographic profile, and Part 2 will consist of the 15-item adversity quotient questionnaire. For the study sampled 246 out of 636 sophomore, junior, and senior nursing students enrolled in the academic year 2024 to 2025 in their second semester, using Slovin's formula. Random stratified sampling ensured proportional representation by year level using an online number generator with a confidence interval of 95% and a margin of error valued at 5%. Participants were randomly selected using unique identifiers and verified for eligibility to minimize selection bias.
Statement of the problem 1. As for the socio-demographic profile of the nursing students, most participants were female, comprising 182, while males comprised only 64. Moving forward, year-level distribution included second year having 89 participants, third year 74, and fourth year students 83, with second year as the highest population. As for the religion, the majority of students identified as Roman Catholic, consisting 185, with smaller representations from other religious affiliations including Islam, Iglesia ni Cristo, Seventh-day Adventists, and Aglipay. Lastly, in terms of monthly family incomes, 14 participants came from families earning below 10,957, placing them in the lower income bracket. 31 participants were from the lower income group, with incomes between 10,157 and 21,914. 37 participants reported family incomes ranging from 21,914 to 43,828. The largest group, 64 participants, belong to the middle income bracket, earning between 43,828 and 76,699. 50 participants fell within the 76,699 to 131,484 income range. 26 participants were in the upper middle income group, earning between 131,484 and 219,140. Lastly, 24 participants were from the upper income families with earnings above 219,140 monthly. The demographic characteristics of the nursing students, mainly female, predominantly Roman Catholic, and representing a wide range of income levels, underscore the need to examine how sex, religion, academic, year level, and socioeconomic status relate to their adversity quotient. Grounded in the frameworks like gender role theory and Roy's adaptation model, the study indicates that these variables influence how students develop resilience and manage challenges. For example, gender norms may affect whether adversity is expressed outwardly or inwardly. Religious affiliations can provide emotional and spiritual support, and financial limitations may heighten stress levels, potentially lowering adversity quotient. Understanding these influences is vital in designing tailored academic and psychosocial interventions that builds resilience among diverse students groups.
Now, let us proceed to the level of adversity quotient as a whole and one group according to profile variables. Both sexes showed high adversity quotients, with males scoring slightly higher, indicating a small difference in how they manage adversity. This is implicated where men may have been socially conditioned to demonstrate strength, suppress weakness, and approach issues with a problem-solving mindset, all of which may contribute to higher AQ scores. In contrast, women are more likely to use emotion-focused coping mechanisms. Moving on, AQ scores remain consistently high across all year levels, with the fourth year scoring slightly higher than others. Older nursing students tend to be more resilient due to their life experiences and develop coping mechanisms in which they frequently exhibit superior stress management skills than younger students, who may struggle more with the transition from high school to a demanding nursing program. Religious affiliation appears to influence adversity quotient scores, with most groups reporting high AQ levels, particularly Roman Catholic, while Muslims reported a moderate AQ, which may reflect different religious experiences, minority stress, or limited community support, emphasizing the role of personal beliefs and faith in building resilience. In addition, adversity quotient levels remain high across all income brackets, with low-income participants scoring slightly higher than high-income ones, potentially reflecting a form of resilience developed through necessity. Repeated exposure to hardship may have equipped these students with stronger coping mechanisms and adaptability. This emphasized that financial constraints, while challenging, can also encourage psychological growth when accompanied by determination and support.
For the level of adversity quotient in terms of different domains, specifically control, ownership, reach, and endurance, the findings reveal that participants generally scored high AQ across 4 domains. This indicates that participants are generally resilient and capable of effectively managing adversity, and high AQ scores across all domains suggest strong personal control, responsibility, focus, and persistence in challenging situations. Now let's move forward to the difference between the level of AQ in terms of each domain, control, ownership, reach, and endurance when grouped according to profile variables. For the control domain, the findings reveal that there is a significant difference between the level of AQ in terms of control domain when grouped according to sex. This indicates that male students tend to exhibit a greater sense of control over adversities compared to their female counterparts. This is also further supported by the findings of Go and others, Perwaningram and Rianto, and Sukaatan and others in 2022 exhibiting higher AQ scores in the control subtype. However, when grouped according to year level, religion, and monthly family income, the results show that there is no significant difference between the level of AQ in terms of control domain. This suggests that the student's sense of control over adversity remains consistent regardless of their profile variables, indicating that these factors do not significantly influence their perceived ability to manage challenges. For the ownership domain, when participants were grouped according to sex, year level, religion, and monthly family income, the result revealed that there is no significant differences in their AQ levels. This suggests that the tendency to take responsibility for adverse situation is consistent across these demographic variables, indicating that the sense of ownership in facing challenges is not influenced by these factors. For the reach domain, when participants were grouped according to sex, year level, religion, and monthly family income, the result also revealed no significant differences in their AQ levels. This indicates that the participants' ability to limit the impact of adversity to specific areas of their lives remains stable across different demographic groups, and their capacity to prevent challenges from affecting unrelated aspects of life is not influenced by their profile variables. Lastly, for the endurance domain, when participants were grouped according to sex, year level, religion, and monthly family income, the results revealed that no significant differences in their AQ levels. This implies that participants' perseverance and ability to withstand adversity over time are consistent regardless of their profile variables. These demographic factors do not appear to influence their long-term resilience in facing challenges.
Now moving on to our last table, which presents the analysis of the adversity quotient grouped according to demographic variables. So it highlights the results that individual resilience is not shaped by surface level factors, but by deeper psychological and experiential influences, as evidenced by there being no statistically significant differences observed across all groups. So this supports the need for universal resilience building programs in nursing education that focus on coping skills and adaptability across all student demographics. Okay, so for our conclusion, our study assessed the adversity quotient of nursing students and its relationship with sex, year level, religion, and family income. Results showed that most students had high AQ levels, especially in endurance, indicating strong persistence during challenges. No statistically significant differences were found across demographic variables, except in the control domain where males scored slightly higher. This supports theories like Stoltz's AQ and Reich's adaptation model, suggesting resilience is shaped more by experience and psychological factors rather than demographics. These findings emphasize the need to integrate structured resilience building strategies in nursing education and promote equitable, supportive environments in both academic and clinical settings.
For the recommendation, institutional administrators should implement resilience programs tailored to each year level, and clinical instructors should offer progressively challenging experience with debriefing and gender-sensitive strategies. Nursing students should practice self-reflection and participate in resilience-building activities. Parents and guardians expose children to age-appropriate challenges, promoting independence and resilience through proper coping strategies. And lastly, researchers should explore the adversity quotient's connection to demographics, conduct longitudinal studies, and include first-year students using mixed methods.
Thank you everyone for watching.